Now, today we are beginning a month-long discussion and a series of stories for you highlighting mental health and wellness in our community. We just wrapped up a Buffalo Strong town hall. We broadcast at 5:30 till 6 tonight, focusing on the stigma surrounding a topic that's often been taboo. People don't like to talk about it, but that should not be the case. Before the pandemic, an estimated 1 in 10 adults in this country reported symptoms of anxiety or depression. And then, by this past January, almost a year into the pandemic, that number had jumped up to 4 out of every 10 adults. Keep in mind, that is only the number of people who have actually reported the symptoms. There are many who have not. The numbers are just as troubling when it comes to our youth. 1 in 5 teenagers have or will experience a serious mental illness. And preteens are also experiencing high rates of depression and anxiety right now. Tonight, 7 Eyewitness News senior reporter Eileen Buckley finds out why and also shows us where you can turn for some help.
Then the thoughts progressed and they got really dark and heavy. And they were more like, I don't want to be here anymore. I just don't want to be in the world anymore.
Heartbreaking emotions described by 18-year-old Zenobia James from New York City. When she was 12 years old and in 7th grade at a charter school, James says she was just one of only 3 black students at the school and was bullied.
I felt like I didn't really have anyone to talk to, so then I started self-harming by cutting myself.
Now a freshman at Marymount Manhattan College, James wrote this story about her experience of self-harm and suicidal thoughts. She wrote it through an organization called Youth Voices. The story is titled, How I Finally Got Mental Health Help. James says she didn't feel comfortable telling her mother how she was feeling. Instead, she says she first reached out to a school counselor and then her doctor, but both dismissed her feelings. You said it was unbearable. I felt like I was practically begging.
I told him I felt anxious. At the time, I didn't know that I had anxiety. I was just kind of telling him the symptoms I was feeling. And he was telling me oh, that's just completely normal. You're just it's growing pains as a teenager. And at first I was okay, maybe he's right. Maybe I'm overreacting. And so I didn't really think anything of it.
The National Alliance on Mental Illness says suicide is the 3rd leading cause of death in youth ages 10 to 24.
When it comes to mental health and mental illness, it's a journey, and it's a journey for young folks.
Alyssa Mary Orazio is a youth peer advocate at the Mental Health Advocates of Western New York. She is studying school psychology in graduate school. Orazio and youth peer advocate Katie Bernard are both working with middle schoolers age 11 to 14 right now in a virtual workshop program called Stuck in the Middle, a support group for the preteens to promote good mental health and help students deal with bullying, anger management, coping, and social skills.
At that age, that's a fragile state in your life. You're growing, you're making friends, you're finding out who you are. And for them to be, stuck at home for a year in isolation, not going to school, not being with their friends, things like that, it's been awful for them.
The youth advocates say they're finding a lot of anger and anxiety among the middle schoolers, and the pandemic has made it much worse.
Are they candid about what is causing that anxiety in them?
They're anxious to get back to school. They're anxious to grow.
That could be anything from having really difficult home lives to kind of just, struggling in school or trying to live up to a specific expectation.
What can parents and caregivers of children do better?
Validate a child's feelings.
Validations of feelings is exactly what Zenobia James searched for during her first mental health episode, before she was diagnosed with depression and anxiety.
I got the help I needed, but it wasn't until people noticed that I was suffering.
What would you tell someone in middle school or in high school that's having, unfortunately, some suicidal thoughts?
Don't let people invalidate your feelings, and even if they're adults, because adults aren't always right.
Eileen Buckley, 7 Eyewitness News.
And here are a couple of very important phone numbers for anyone out there who is in need of help. Erie County Crisis Services, you can call 834-3131. And then in Niagara County Crisis Services, the number there is 285-3515.